Okay guys, my name is Dr. Khan. I am an anesthetist and intensivist. I'll be dealing with this topic of anesthesia. Let us start with this topic called as BLS and ACLS. You might have heard about BLS and ACLS. BLS is basic life support. ACLS is advanced cardiac life support. Advanced cardiac life support. Come on guys, starting with this first thing which is called as BLS or basic life support. When do you call a life support as basic life support? When do you call it as BLS and when do you call it as ACLS? When it is BLS, when it is ACLS. Now before solving this, first we need to understand. I'll give you a case scenario guys. Imagine you are standing on a bus stop. You're talking with someone. You're standing on the bus stop and you're talking with someone on phone. You see a person crossing the road. And in the next glance when you see the person who was crossing road, he suddenly falls down. He becomes unconscious. What is the first step we need to do in order to save his life? What's the first step we need to do guys in order to save his life? Now don't tell sir, I'll look for the pulse, I'll look for the breathing, I'll look for this and that. No. First step is what? Scene safety. Scene safety. What is scene safety meaning? Where is the person lying down? On the middle of the road. Don't try to become a hero on the middle of the road. Even though you might be knowing how to give compressions and all, don't try to become a hero over there. What you need to do? Scene safety meaning what? The patient is in the middle of the road. Drag the person to corner. Drag the person to corner. So that now he is safe. Now you can save his life. So first step is what guys? Scene safety. Once the scene is being ensured that it is safe, the second step. But before going to the second step, first we need to understand guys, what is BLS? What is BLS? What is BLS? The full form of BLS, everyone will tell. The full form of BLS is basic life support. But what is the definition of this basic life support? It is a life support given to a cardiac arrest patient without medical equipment or without any drugs. You are in the road. You are giving BLS meaning what? You are not having drugs in your pocket. I'm not talking about those drugs. I'm talking about the medicines, okay? So you're not having any medicines in your pocket. You're not having any airway devices or you're not having any devices to save the patient's life. So basic life support means what? Life support. It is a life support given to cardiac arrest patient, without drugs or medical equipment. Without drugs or medical equipment. That is called as basic life support or BLS. That is called as basic life support or BLS. Then there is ACLS. ACLS. What is ACLS? Advanced cardiac life support. Advanced cardiac life support. Now what is this advanced cardiac life support? Advanced cardiac life support is again the care or life support given to what patient? Same patient. Given to cardiac arrest patient with medical equipment and drug. With medical equipment and drugs. Advanced cardiac life support is the life support given to a patient with medical equipment and drugs is called as ACLS or advanced cardiac life support. Advanced cardiac life support. So we have talked about BLS, we have talked about ACLS. Now we need to elaborate this BLS or basic life support. Come on guys, we are discussing about basic life support. What we need to discuss in basic life support? What is the initial step or what is the first step of basic life support? Whenever a person suddenly collapses, I gave you an example that a person has suddenly collapsed on the middle of the road. What will you do in order to save his life? The first step that we need to do is scene safety. Scene safety. But now, if I tell you that you are in a movie theater enjoying some movie and there is a person beside you, sitting beside you, you see that the person who's sitting beside you, he suddenly becomes unresponsive. Suddenly he becomes what? Unresponsive. In this scenario, what will you do? And again, he suddenly becomes unconscious. Here also, the first step remains what? Scene safety. Now you must be wondering, what scene safety, sir, over here? Already the scene is safe, no? What scene safety? Scene safety doesn't mean that dragging the person to corner. Scene safety also means what? You have to look for any potential hazards nearby the patient. You have to look for any potential hazards nearby the patient. He was sitting at the seat. There might be a live wire in the theater. He might have caught the live wire, got the shock from it, and he might have developed cardiac arrest. First step is always ensure that the scene is safe for you as well as the patient. So now we are again coming back to the road. The person has collapsed in the middle of the road. First step, what do? You take the person to the corner and you go for that step is called as scene safety. After scene safety, what is the next step? First step was scene safety. Now you have dragged the person to the corner. What's the next step? You tap on the patient's shoulder and you check for the response. You check for the response. If the patient is not responding, that means he is in a grave emergency and you go for the third step, right? So the first step is scene safety. After scene safety, the second step is what, guys? You check for the response. We are basically discussing about the steps of BLS. Steps of BLS. What is BLS? Basic life support. The steps of BLS, basic life support. What is the first step in BLS? Scene safety. Once the scene is safe, what is the second step? You check for the response. You tap on the patient's shoulder and you check for the response. Imagine if the patient is not responding. If no response, if the patient is not responding, what is the third step? If there is no response, you go for the third step by calling for help. You call for help. Why do you call for help, guys? Why do you call for help? Imagine you yourself as a doctor. Why do you call for help? Imagine you are a doctor, you are standing on a bus stop. Now guys, don't tell me that, sir, I am a doctor. Why will I stand on a bus stop? It might happen, guys. You are a doctor, you are standing on a bus stop, you are talking with someone special on phone and the person is crossing road. He suddenly falls down. First step you do is scene safety. You drag him to the corner. Second step is you tap on the shoulder and you check for the response. He is not responding. The third step is you shout for help. Why did you shout for help? Even though you yourself as a doctor, why did you shout for help? Why? Because you shouted for help for what reason? Don't tell me the reasons like, sir, we need to start compression, we need to call an ambulance to start compression. No, you can give compressions. Why you want anyone? You call for help for the reason. Why? Because the most common cause of cardiac arrest is what? It is the abnormal rhythm of the heart. The most common cause of cardiac arrest is the abnormal rhythm. What abnormal rhythm? VT and VF. Ventricular tachycardia and ventricular fibrillation. These two abnormal rhythms won't be treated by your chest compression. These two abnormal rhythms require what? they require a shock machine which is called as defibrillator, right? So why do you call for help? You call for help so that the person who you call for help, he gets a machine called as AED, or he gets the ambulance which has a defibrillator. Remember guys, the shock machine I am talking about. You call for help to get a shock machine. Shock machine is called as defibrillator. There are two kinds of defibrillator. One is called as AED, other is called as manual defibrillator. You might be seeing that defibrillator in the movies where the doctor rubs the defib pads and keeps it on the patient's chest and then gives the shock manually. That is manual defibrillator. That defibrillator is called as manual defibrillator, right? But in Western countries, you will find a machine, this shock machine called as AED, which is stored in traffic signals, cinema halls, shopping malls, gymnasium, right? Everywhere you will find a small AED machine. I'm talking about this machine, guys. This is called as AED machine, automated external defibrillator. Automated external defibrillator. And this is called as what? Manual defibrillator. One we see in the movies. Manual defibrillator. So you call for help so that the person who you call for help, either he gets an AED or either he gets a manual defibrillator. So if there is no response, you call for help. What are the two reasons for calling for help, guys? What are the two reasons for calling for help? Either the main reason is to get a defibrillator. Either the person who you call for help, either he gets an AED or either he gets an ambulance that has defibrillator. Ambulance that has defibrillator, right? So you call for help for two reasons. First is either he gets an AED, or second, either he gets an ambulance that has a defibrillator, right? Now, after calling for help, your friend has gone for help, now you are there with the patient. What is the next step that we need to do? The next step that we need to do is what, guys? After calling for help, what is the next step that we need to do? The next step is you check for the pulse as well as breathing. First, we will review the first three steps. All should come in this chronology. Once the person is collapsed, the first step, you drag him to the corner, that is scene safety. Second step, you look for the response or check for the response. He is not responding. The third step is what? After checking for the response, the third step is you call for help. The person who you call for help, either he gets an AED or an ambulance that has a defibrillator. Fourth is now you are with the patient. You check for the pulse as well as breathing simultaneously. You will check for the pulse and breathing. Check for the pulse and breathing simultaneously. How? How will you look for the pulse and breathing simultaneously? First of all, which pulse will you look for? We look for the carotid pulse or we look for the radial pulse. Always we look for the carotid pulse. Why? The carotid pulse is directly in line with the heart. We look for the carotid pulse while the eyes should be on the patient's chest, right? While locating the pulse, eyes should be on the patient's chest. If you don't feel any pulse and if you see no movements, then it forms a triad of cardiac arrest. So once again, guys, pulse and breathing should be checked simultaneously, right? So we look for carotid pulse and while locating the pulse, eyes should be where? While locating the pulse, eyes should be on patient's chest. Eyes should be on patient's chest. if no pulse, if there is no pulse, right there guys, if no pulse and no breathing and no response, if the patient is having no pulse, no breathing, no response, this forms a triad of what arrest? Cardiac arrest. Cardiac arrest. Cardiac arrest means no pulse, no breathing, no response. What is the next step? You go for the fifth step. The fifth step is what? You start your compressions. Yani you start your CPCR, right? If there is no pulse, no breathing, no response, the patient is in cardiac arrest, you start your CPR. Remember, initially it was called as CPR. Now we are calling it as CPCR. What is the difference between CPR and CPCR? CPR means you were reviving the heart and lungs, but you were missing out on the major organ which was also being revived. That is added in CPCR. CPCR means what? Cardiopulmonary cerebral resuscitation. Cardiopulmonary cerebral resuscitation. So anyways guys, you start your CPR or CPCR by what protocol? Will you go for ABC? ABC was done 15 years back. You always start your CPCR by CAB protocol. By what protocol guys? CAB protocol. CAB protocol. What is that CAB protocol means? C is for compressions. A is for airway. And B is for breathing. Compressions, airway and breathing. Regarding the compressions guys, how will you start compression? What is the site of compression? What is the site where you give this chest compression? What is the site guys? It is the lower third of the sternum. It is the lower 1/3 of sternum. That is the site of compression. Next, what is the rate of compression in 1 minute? In 1 minute, how many compressions? I know most of you are getting the answer as 30, but that's totally wrong. In 1 minute, 100 to 120 compressions you have to give. But you have been fed as 30:2, 30:2. I'm not asking you the ratio guys. I am asking you in 1 minute, how many compressions? So first of all, you place your hands on the lower third of the sternum. Right? Lower third of the sternum. Next, you need to give compression. When you start your compressions in 1 minute, the compression rate should be always more than the upper range of your normal heart rate. Upper range of your heart rate. Upper range of your heart rate is how much guys? Range of heart rate is 60 to 100. Upper range is 100. So compression should be in 1 minute 100 to 120 per minute. 100 to 120 compressions per minute. Are you giving that 100 to 120 compressions continuous? No sir, I don't give continuous. What should I do? I will give 30 compressions, then I'll give 2 rescue breaths. I'll give 30 compressions, then 2 rescue breaths. 30 compressions, then 2 rescue breaths. 30 compressions and then 2 rescue breaths. How many times I have repeated it? 4 times. In 1 minute, the ratio of compression guys is what? The ratio is 30:2. But how many sets of 30:2? 4 sets. 4 sets of 30:2. You have to give in 1 minute. 4 sets of 30:2 compressions you have to give in. Compression and breathing you have to give in 1 minute. 4 sets. If you give 4 sets, 30 into 4, how many compression? 120 compression. 2 into 4, 8 rescue breaths. That is the ideal thing. So in 1 minute, how many compressions guys? 100 to 120. What is the ratio of compression? 30:2. The ratio is how much guys? 30:2. So we know the site of compression, we know the rate of compression, and we also know the ratio of compressions. Right? Now we need to know the depth of compression. The depth of chest compression. When you are giving chest compression to the patient, what should be the depth of it? Remember guys, in adults, the depth of chest compression should be how much guys? In adults, the depth of chest compression should be 2 to 2.4 inches or 5 to 6 centimeters. 2 to 2.4 inches or 5 to 6 centimeters. You should never exceed this depth. If you exceed this depth, many of the patients will develop injuries to the ribs and all. But again guys, knowing what is the depth of compression during giving compression, it is very difficult guys. Imagine you are giving chest compression to the patient and you are having the depth of compression as 2 to 2.4 inches in your mind. You can never calculate the depth of compression with your hands and all. Just by imagining that this could be the depth, you can give compressions. In the other Western countries, you are having some devices to know the depth of compressions and all. Okay. So anyways, that's regarding the depth of compression. Imagine guys, you have given 30 compressions to the patient. After giving 30 compressions, what will you give? 2 rescue breaths. Yani ki after giving each 30 compressions, you have to give 2 rescue breaths. But I told you we are dealing with what protocol? C, A, B. Not only just C and B. C and B means what? C is compression, B is rescue breaths. We are missing out on A. A is what? Airway. Just imagine this is2 symbol as airway. So after 30 compressions, before giving 2 rescue breaths, what I'll do? I will give 30 compression. I will stop. I will open the airway and then give rescue breaths. I will open the airway and then give rescue breaths. How should I open the airway guys? How should I open the airway? Remember guys, in a person where you don't suspect any neck injury, you open the airway easily by doing head tilt and chin lift. In a person where you don't suspect any neck injury, remember guys, we are still dealing with CAB protocol. C stands for compression, A is for airway, B is for breaths. How many compressions in 1 minute? In 1 minute, 100 to 120. And remember, what's the ratio? 30:2. Now, just look over here, guys. After finishing your 30 compressions, first we open the airway. We open the airway. How will you open the airway of the patient, guys? You open the airway. If you don't suspect any neck injury, you open the airway by head tilt and chin lift. Head tilt and chin lift. You can see this picture. She is opening the airway by head tilt and chin lift. In any normal person. In normal person means what? Person without neck injury. Person without neck injury. You open the airway by head tilt, chin lift. If the person is having neck injury, if the person is having neck injury, if neck injury is there, then how will you open the airway? If a person is having neck injury, you open the airway by jaw thrust. You open the airway by jaw thrust. There should be no neck movement. You just protrude the jaw a bit out, right? If neck injury is suspected, then jaw thrust needs to be done. Jaw thrust needs to be done. What is this jaw thrust, guys? Jaw thrust is basically you stand behind the patient, keep your 3 fingers beneath the jaw of the patient, keep your thumbs on the malar prominence and give or protrude the jaw a bit out, so his airway will be open. That is called as jaw thrust. Jaw thrust. So in neck injury, you open the airway by jaw thrust, right? Next, after opening the airway, then you have to give 2 rescue breaths after each 30 compressions. After each 30 compressions, we open the airway and deliver 2 rescue breaths. 2 rescue breaths. Now guys, how will you deliver the rescue breaths? Are you having any airway devices in your pocket to deliver the rescue breaths? No sir, we don't have any airway device. So how will you deliver the rescue breaths? The rescue breaths are given mouth to mouth. The rescue breaths are given mouth to mouth. Right guys? Once again, we are just dealing with the basic life support. The first step of basic life support, you have to remember in this order. First step, if the patient collapses, I'll drag the patient to a corner. The first step is scene safety. The second step in basic life support is I check for the response. I tap on the patient's shoulder and check for the response. He's not responding. The third step is what? I shout for help. Why am I shouting for help? Why? Because I want a defibrillator, either in a form of AED or either in a form of manual defibrillator, but I want a defibrillator. Next step is what guys? After calling for help, you check for the pulse and breathing. Which one should be checked first? Both should be checked simultaneously. Pulse and breathing needs to be checked simultaneously. If there is no pulse, no breathing, no response, it forms a triad of what arrest? Cardiac arrest. Next step is immediately start your CPCR. Immediately start your CPCR. How will you start your CPCR? Will you start your CPCR by ABC protocol or will you start your CPCR by CAB protocol? You start your CPCR by CAB protocol. In that C stands for compression, A stands for airway, B stands for breathing. Compressions, airway and breathing. Right? How many compressions you have to give in 1 minute? In 1 minute, 100 to 120 compressions. Are you giving continuous? No sir. I am giving intermittent in a ratio of 30:2. 30:2. After giving 30 compression, I will stop, I will open the airway and then deliver 2 rescue breaths. Remember guys, in 1 minute, the compression should be 100 to 120. The ratio should be 30:2. The ratio of compression should be what guys? 30:2. Now imagine guys, your friend is there. Now he comes with this machine. He comes with this AED machine. Once he comes with this AED machine, what will you do guys? Once your friend comes with the AED, first of all guys, I told you there are 2 kinds of defibrillator. This is the picture of what? Defibrillator. There are 2 kinds of defibrillator. One is AED, other is manual defibrillator. Right? Which defibrillator your friend is bringing? Your friend bought the AED. What is AED? Automated external defibrillator. Right? Once your friends arrive to the scene with AED, what is the next step that we need to do guys? Once AED machine arrives, once AED machine arrives, the first step that we need to do is attach the AED pads. Attach the AED pads. Where will you attach the AED pads? Will you attach one to the right, one to the upper right of the chest, other to the upper left of the chest? Will you attach the pad this side by side? No. One pad you will attach to the upper right of the chest, other pad you will attach at the left side, at the lower surface of left chest or at the lower side of the left chest. Why are you attaching the pads like this? Why? Because like our aim should be, when I am giving shock, the top to bottom of the heart should be shocked properly. To ensure that the top to bottom of the heart is shocked properly, we attach the pad where guys? One at the upper right of the sternum, at the other at what? Lower side of the left chest. Lower side of the left chest. So you attach the pads. One pad you are attaching at the upper right to the sternum, and other pad where you are attaching guys? You are attaching the other pad at the lower side of the left chest, lower side of left chest. After attaching the pads, you tell the command all clear. You shout out the command all clear, all clear. After shouting out the command all clear, what will the machine do? The machine will automatically detect the rhythm. It will automatically detect the rhythm, and if required, it will deliver the shock. And if required, shock will be delivered. If required, shock will be delivered. Right? The machine will automatically detect the rhythm, and if required, it will deliver the shock to the patient. Now guys, look over here. Basically, you are giving this, I'm talking about the road scenario. You are giving this life support to a patient on the road. So if the patient is suddenly collapsed, the first step is what, guys? Scene safety. The second step is you check for the response. If he is not responding, the third step is call for help. Fourth step is you check for the pulse and breathing, and fifth step is what? You start your CPCR, right? As you are giving compressions and all, they will be, you are on the road, right? Now as you are trying to save a life, there will be 10 or 15 people surrounding you. There will be nearly 10 to 15 people who will be surrounding you. Some 1 or 2 people will be taking their phones, and they will be doing what? They will be just taking the videos of you giving the life support. It's not at all bothering thing, guys. It's a normal thing. Nowadays everyone records everything. So if he records a video, there is not a problem. You just continue with your compressions. Okay? Unless and until he is not disturbing you, it shouldn't be bothering you. You should continue your compressions. If the patient life is saved, you will be a hero by his video. If the life is not saved, you go to him and tell him, please delete the video. Okay? So anyways, so you are giving compression. Other person is standing nearby you, is taking a video. Some 1 or 2 geniuses will be there in the crowd. What they will do, you know, they will basically tell you, they will school you, tell you what? They will tell you that please give some water to the patient. This has happened with me, guys. It will happen, like there will be some patient, they're telling that give water to the patient, right? They are basically thinking for the person, but you need to make him understand that water should not be given to this patient. If I give water to the patient, what will happen, guys? That water will go into the trachea and into the lungs. If the patient survives after cardiac arrest, he will die due to aspiration. So you can't give water. Once I was giving compression to the patient of cardiac arrest. Basically, I was in a mobile shop and I was giving these compressions. There was a guy who was standing there. He was advising me to give water. When I did not listen, this guy went to the other shop and he bought a dairy milk chocolate. And he told, please give dairy milk chocolate to the patient. I explained him, I knew that he was concerned about the patient. But I was telling him, it shouldn't be given. But this guy was constantly giving me this chocolate and telling me to give him. I took this chocolate and kept in my pocket. Because why to waste the chocolate? I kept that chocolate in my pocket. But if I would have given that chocolate, what would have happened, guys? If the chocolate goes in a solid form into the trachea and does not melt, the patient will die due to choking. If the chocolate goes in the liquid form, the patient will die due to aspiration. Right? So it shouldn't be given. But guys, if people are constantly irritating you, you just look for those people and you just mark those people, okay? Now, once the AED machine comes, you can take a revenge. You can take a revenge. What revenge you will take? You attach the AED pads. After attaching the pads, now you call these 2 geniuses who were disturbing you. Call the genius number 1 and tell what? Sir, from that time you were advising me to give this and that. I am sorry I was not listening to your advice. Even though I have explained you, but you did not listen. But still, I am sorry that I did not listen to your advice. Can you help me? Now this genius will feel what? He'll feel that, okay, this guy has realized his mistake. Okay? Now you tell to this genius, can you help me? He'll tell, yes, why not? Tell him to hold the hands of the patient. Hold the hands of the patient. Other genius will be there, he'll be telling, from that time I am also advising, is there any work for me? You tell, yes, bhai, there is a work for you. You just hold the legs of the patient, right? Now slowly you tell him to hold the legs of the patient. Then now you slowly step back. Okay? You step back and you tell the command all clear very slowly. Now what will happen? You don't do anything, the machine will do. What will the machine do? The machine will analyze the rhythm if required. If required means what? If VT and VF is there, shock will be delivered to the patient as well as the geniuses. And now the geniuses will learn the lesson that not to disturb a doctor when he is saving a life. This should not be done, guys. It is just I'm telling. I have also not done this. Why? Because the shock that you are delivering, it's a very high shock. So it should not be done. But again, if some geniuses are constantly bothering you, you don't have any choice. It's up to you. Okay. So anyways, guys, remember AED machine. Once the AED machine arrives, first you attach the AED pads. Second, you tell the command all clear. Third, what the AED machine does, AED machine will detect the rhythm and if required, it will only decide whether to shock or not. Remember guys, shock is given to only 2 shockable rhythms of the heart. What are the 2 shockable rhythms of the heart that requires shock? One rhythm is called as VT, which is ventricular tachycardia. Other rhythm of the heart is called as VF, which is ventricular fibrillation. One is called as VT, other is called as VF. This rhythm that you see over here, it is VF. VF means if you give a pencil to 1-year-old or 2-year-old, he will just scribble. Yes or no? A scribbling type of rhythm on ECG is called as VF, ventricular fibrillation. Whereas this rhythm on ECG is called as VT, ventricular tachycardia, right? So remember guys, shock is given for only 2 shockable rhythms. What are the 2 shockable rhythms? VT and VF. What if you see a flat line? If you see a flat line, what will you do? Will the shock be delivered? No. The machine will tell you no shock delivered. What is the next step if you see a flat line? Continue your compressions. If you see a flat line, no shock will be given. Next step is continue your compressions. Yani ki continue compressions. Right? So remember, this is regarding what? This is regarding the AED machine. The only device that could be used in BLS is what, guys? AED machine. Otherwise, BLS is the life support given to a patient without, patient means cardiac arrest patient, without medical equipment and drug. That is called as basic life support, right? So remember guys, why are you using AED? Why? Because the most common, or why do you use defibrillator in basic life support? Why? Because the most common cause of cardiac arrest is what? It is the 2 abnormal rhythms, which are VT and VF. These 2 abnormal rhythms will be easily managed by what? By a defibrillator. Guys, what is the most common cause of cardiac arrest in infants? In adults, the most common cause of cardiac arrest is VT and VF. Whereas in infants, the most common cause of cardiac arrest in infants is the respiratory problems. The respiratory disorders or respiratory problems. Okay. So this was regarding the basic life support. Coming to what, guys? Coming to ACLS. ACLS was what? Advanced cardiac life support. ACLS means what, guys? Advanced cardiac life support. Guys, remember, ACLS is a teamwork. ACLS is what, guys? ACLS is a teamwork. Teamwork meaning what? Where there will be a team of doctors or team of paramedical staff. Okay, ACLS is a teamwork where there will be a team of doctors or team of paramedical staff. Where one person, remember team means there will be 5 persons. Okay, but before going to the teamwork, I'll give you a case scenario. Guys, remember, imagine you are in a hospital, you are in a hospital duty, you are posted in a general ward, okay, and in general ward you are busy writing the case sheets. There is a person who is lying down on his bed, right? You have just seen the patient. Now you're just writing the case sheet busily. Suddenly, the person who was lying on the bed, suddenly he becomes unresponsive. When he becomes unresponsive, what is the first step that we need to do in order to save his life? Whether it is BLS or whether it is ACLS, the first step remains same. What is the first step, guys? The first step is what? Scene safety. Now you must be wondering, sir, in hospital, what scene safety we have to do? Hospital is always safe only, no? What scene safety? In hospital, the scene safety that we do is what? Remember, guys, scene safety doesn't mean that to drag the person to corner. Scene safety meaning what? Look for any potential hazards nearby the patient. Again, in hospital also there might be a live wire. The patient might have got shock from the live wire. If the live wire is nearby the patient, you might also receive the shock. So, the first step, whether in BLS or ACLS, will be scene safety. Remember, guys, whether it is BLS or ACLS, the steps are almost same. The first step for BLS and ACLS is what? Scene safety. The second step for BLS and ACLS is what, guys? You check for the response. You check for the response. If the person is not responding, you go for the third step. In the hospital, the third step is what? Come on, guys, what is the third step for BLS? You call for help. In the hospital also you call for help, or you can activate the emergency response system. Or you can activate the emergency response system, which is also called as code blue. So in BLS or ACLS, the first step is scene safety. The second step is check for the response. If the patient is not responding, you go for third step, which is what, guys? Call for help or activate the emergency response system. Okay? After that, the fourth step in ACLS will be what, guys? Same like BLS. Check for the pulse and breathing. While looking for the pulse, eyes should be on chest. If the patient has no pulse, no breathing, no response, it is cardiac arrest. Now you have to go for the fifth step. The fifth step is also same. What is the step? You go for CPCR. That is CAB. Will you go for ABC or CAB? You go for same CAB protocol. CAB protocol. Now you are about to start your compression. The team arrives to your ward. The team arrives to your ward. Okay? When the team arrives, guys, remember you were the first person over there. So first thing is you become the team leader. The first person becomes the team leader. The second person who's there, you give him the responsibility of chest compressions. You give him the responsibility of chest compressions. The third person who's there, you give him the responsibility of airway and breathing. Airway and breathing. Third person, you give the responsibility of airway and breathing. The fourth person who's there, you give him responsibility of loading the drugs and giving it to the patient. Loading the drugs and giving it to the patient. The last person who's there, you give him responsibility of defibrillator. Defibrillator. So again, guys, 5 persons are there. Remember, ACLS is a teamwork where there are 5 persons. As you were present from the starting of the scene, you become the team leader. You give one responsibility of compression, another airway and breathing, another loading the drugs, and last defibrillator. ACLS, BLS steps are same, but over here, now we are having persons, we are having drugs, we are having equipments in the hospital. So now we can take the help of the drugs as well as equipment. So what we will do, if I am the team leader, I will tell that you give chest compression. I'll give responsibility to one person as you give chest compression. He will be giving chest compressions. He'll be giving chest compression. The third person I'll give responsibility what, guys? You take care of the airway and breathing. The person who I give the responsibility of airway and breathing, how will he give the rescue breaths? Now don't tell, sir, we will give rescue breaths mouth to mouth. We were enjoying giving rescue breaths mouth to mouth. No, you are in the hospital. How will you give rescue breaths? With the help of airway devices. 2 airway devices I will give you. One is the normal oxygen mask, one is the endotracheal tube. How will you give breaths? Normal oxygen mask, or one is the ambu bag, or one is the endotracheal tube. How will you give rescue breaths? The best way to give rescue breaths is by intubation. First is best way is what, guys? Intubate the patient. You intubate the patient, right? The one who is giving this rescue breaths, how will he give rescue breaths? With the help of ambu bag or with the help of endotracheal tube? What do you think, guys? Ambu or endotracheal tube? Which one is the best? Always go for endotracheal tube. That is the best way to secure the airway. 100% you will be sure what? 100% you will be sure that you are in the trachea and you are ventilating the lungs. Right? Ambu bag and all. Again, what will happen if you give rescue breaths with ambu bag? The moment the rescue breaths goes into the esophagus, remember with ambu bag, the gases will go into the trachea. But some of the gases might go into the esophagus also. The moment the gas goes into the esophagus, the patient will aspirate. The patient will aspirate. So how will you give rescue breaths, guys? The best way to give rescue breaths in the hospital setting is by putting an endotracheal tube. So the third person is responsible for airway. He'll basically put an endotracheal tube and he'll secure the airway. Okay? But remember, guys, the one who is giving compression, this poor guy, just don't give him the responsibility of compression. What do you need to tell? After 2 minutes, he'll get exhausted. So what do you need to tell? Every 2 minutes, you switch your position with the one who is taking care of the airway. These are the positions that can be switched, guys. The one who is giving compression, he can switch it with airway and breathing. And the one who is taking care of airway, he can give compression every 2 minutes. Why? Because you will get exhausted. Okay. So remember, guys, the first one was a team leader. I was a team leader. I gave the responsibility that you start compression. I gave other person responsibility that you give air, you secure the airway and give rescue breaths. The best way to secure the airway is by what, guys? Endotracheal intubation. The fourth person is responsible for loading the drugs and giving it to the patient. The drugs. The drug of choice in cardiac arrest. The drug of choice in cardiac arrest is what, guys? What's the drug of choice in cardiac arrest? The drug of choice in cardiac arrest is epinephrine or adrenaline. That's the drug of choice. Apart from that, we can give amiodarone, magnesium and lignocaine. Why they are given? Why? Because these are the drugs which are having antiarrhythmic properties. Okay? Why? Because the most common cause of cardiac arrest is the abnormal rhythm, VT and VF. For the management of VT and VF, best is shock. Apart from shock, we can give amiodarone, magnesium and lignocaine also. So anyways, guys, look over here. We were discussing about cardiac arrest. So in cardiac arrest, the drug over here is amiodarone, magnesium, lignocaine, but the drug of choice is epinephrine. Why are we giving lignocaine? Amiodarone and magnesium are having antiarrhythmic properties, but why lignocaine? Don't think in this manner that lignocaine is used for pain purpose, pain relieving purpose over here. No. Lignocaine is used for what purpose? Lignocaine is also used for antiarrhythmic. Lignocaine, apart from being a local anesthetic, it's also an antiarrhythmic. How will you give these drugs, guys? The drug of choice is epinephrine. The dose is 1 milligram. How will you give this adrenaline or epinephrine? The best route of choice is by IV route. Place an IV cannula and give the drug. But that's very challenging. Why it is very challenging, guys? Why it is very challenging? Why? Because to put an IV cannula, the hand should be stable. But one of your friend is continuously giving compression. If he is continuously giving compression, the hand is also moving. How will you place an IV cannula when the hand is not stable? You can't place an IV cannula if the hand is moving. So guys, remember, this is very difficult to place an IV cannula. But again, with skills you can place IV cannula also. But imagine guys, you are not able to place IV cannula. Then how will you deliver this adrenaline or epinephrine? How will you deliver? If IV is not possible, you go for IO route. IO route. What is IO? Intraosseous. If IV is not possible, IO. Intraosseous. Commonly it is used in children. Intraosseous means inside the bone. You take a long bone such as tibia or femur and you insert this adrenaline injection. Imagine IV is also not possible. IO is also not possible. Then the last route that is left out with us is what? Endotracheal route. Endotracheal. Yani ki your friend has inserted the endotracheal tube, no? You take adrenaline ampule and pour that adrenaline ampule into the endotracheal tube. That adrenaline gets absorbed and the effect will come. But remember guys, when you are giving adrenaline through the endotracheal route, the dose is not 1 milligram. It will be always 2.5 times the IV dose. 2.5 times the IV dose. Right? So the drug of choices, as I already told you, epinephrine. Right? The dose is 1 milligram. The concentration that we use is 1:10,000. That's the dilution, guys. That's the dilution of adrenaline. The route of choice is IV. If IV is not possible, IO. If IO is not possible, then endotracheal. But when you are giving endotracheal adrenaline, the dose should be 2.5 times the IV dose. Means how many milligrams? 2.5 mg. Apart from adrenaline, there are some more drugs that can be delivered through endotracheal route. But it doesn't mean that all are given in cardiac arrest. There are some drugs which are having good absorption through the endotracheal route. Okay? It doesn't mean that they are giving in cardiac arrest. The drugs that are having good absorption through the endotracheal route are lean drugs. Lean drugs. L stands for lignocaine. E stands for epinephrine. A stands for atropine. N stands for naloxone. Lean drugs are having good absorption through the endotracheal route that can be used in what arrest? That the lean drugs are having good absorption through the endotracheal route. It doesn't mean that they are used in cardiac arrest, okay? Lean drugs. Now, what else we need to remember? Apart from these drugs, there were some more drugs previously given for cardiac arrest but not used nowadays. What are the drugs which are not used nowadays and previously given? Previously we used to give atropine, but atropine has no role in cardiac arrest. Atropine is given for bradycardia, for a beating heart with a slow rate you give atropine. Okay? Atropine has no role in cardiac arrest. Previously we used to give calcium gluconate in cardiac arrest routinely. Calcium gluconate is also not routinely used nowadays. If you give calcium gluconate, most of the patients were developing cell injury. So calcium gluconate is also not given nowadays. Previously, we used to give dextrose containing fluid to the patient whenever the patient develops cardiac arrest. If you give dextrose containing fluid, remember we were thinking that all patients of cardiac arrest will have hypoglycemia. That was not the case. If you give dextrose containing fluid for all the patients, most of the patients after survival they were dying due to cerebral or pulmonary edema. Dextrose causes cerebral or pulmonary edema. So remember guys, the drugs which are not indicated for cardiac arrest are atropine. Remember the drugs which are given are, we have already discussed. In cardiac arrest, atropine is not recommended. Right? These are not used in cardiac arrest. Right? Atropine is not at all used. Dextrose containing fluids are not used. Unless and until there is hypoglycemia, no need of using dextrose. If you use dextrose, what will happen? the patient will land up into cerebral or pulmonary edema. Cerebral or pulmonary edema. Apart from that, calcium is also not used. Calcium gluconate is also avoided in cardiac arrest. Why calcium gluconate is avoided? Why? Because calcium causes cell injury. Calcium causes cell injury, hence it is avoided in cardiac arrest. These are the three things we need to remember. Atropine is avoided, dextrose is avoided, and calcium gluconate is avoided in cardiac arrest. This is regarding what, guys? This is regarding the ACLS and BLS. Okay, thank you.